Hey everyone, this is Ben with Cholinergic and in this video I'm going to talk to you a little bit about some ways you can treat or control your symptoms of cholinergic urticaria using various medicines that are available. And what I'm going to do is I'm just kind of going to read off a list of certain medicines, and I'll give you a little bit of my opinion or experience with them every time I do that. And where I got this list is basically it's my own experience. It comes from research articles I've read, information I found on blogs and internet, and also a lot of it comes from my own website where either I've written articles about it or people have posted and talked about it in their experience. So the main takeaway I want you to have in this video is this is just a list of ways that you can begin to think about treating your cholinergic urticaria or reducing symptoms. It's not going to cure you in most cases, although some of these may knock your symptoms down enough to where you can manage them well. And there are other ways besides using these medicines that you can control symptoms, and I'm going to talk about all those in another video. But so just keep that in mind. And also I just want to say that, I'm not a doctor and this is not medical advice. I'm not telling you to take these medications. You take this information and then you ask your doctor about, trying each one, and then you work and you see, is anything here going to help me? And that's the way I hope that you use this, and I hope that you can find this useful. So the first thing I'll talk about is just vitamins and supplements. I've mentioned in another video that, some people have noticed a vitamin D deficiency, that when they, got vitamin D supplementation from their doctors, they noticed that their hives either improved or went away. This doesn't seem to be common for everyone, but if you are low on vitamin D, or if you don't take supplementation, it's fairly inexpensive. You can usually buy it over the counter. I would definitely talk to your doctor about it first. And, they make it in a lot of different size units, everything from like 400 international units all the way up to like 5,000, I think, that you can buy over the counter. You usually only need about 500 to 1,000, I think, is what most research studies suggest per day. But again, talk to your doctor. You can have a simple blood test if you suspect you may be vitamin D deficient. Most of the population is anyway, because most of us work indoors now, so we're not outside in the sun and soaking up that vitamin D. So that's one possibility. Also, you can take multivitamins, and that's just going to help with, any general vitamin deficiency that you may develop. I take a multivitamin, it's Centrum, and I'll include that when I talk about the whole list in another video of things I do for my cure, so to speak. And I just take a regular adult multivitamin, and it's probably a good idea if some studies have said that they're not effective, but in cases with cholinergic urticaria where it's possible that you could have some deficiency, I think it's probably a good idea to take them, especially in my case because I eat a very limited diet. And so I take a multivitamin in hopes that I'll be able to supplement some of the things I may miss out on eating a wider range of foods. Vitamin B is something that other people have mentioned, and you could take B complex or like B12 or B6. Those are some things that people have suggested that when they took them, it helped their hives a little bit. Now, I don't think anybody's ever been cured by taking them, but there have been a couple of reports that, hey, yeah, when I started taking this medication, it seemed to help my hives a little bit. Some people have talked about taking the fish oil pills or the omega-3 fatty acids. I never really took that. I have tried vitamin B, and I didn't really see anything from that. I take a multivitamin, and I think it does, help with nutritional needs, but it didn't really make a major impact on my hives. And I've never really taken the fish oil pills. So some people have acted like, yeah, it helped them a little, or, maybe it's a good idea to take them. But again, use your own judgment there. Vitamin C is kind of interesting because, there's a lot of literature that suggests that it can help your immune system. And I've also read some articles that vitamin D can actually help to reduce some of the histamine in your body. So it could help kind of act as a buffer or an antihistamine, so to speak, by taking vitamin C supplements. I took vitamin C supplements for a while when I had it pretty severely, and I never did really notice a benefit from it. It didn't really seem to help my hive, so I stopped taking it as an individual supplement. But, it's a possibility that it could help you. It's just something that you can keep in mind. Probiotics is something else. I take probiotics. I usually take a kind called Digestive Advantage. There's brands called Align, Culturelle, Probiotic Pearls, Acidophilus, I think it's another brand or another type. And you can take these supplements as, to help your digestive health. And also some studies have suggested that it can have an effect on allergies, and it may help reduce allergies. Kind of makes sense because the majority of your immune system is in your stomach. You know, if you think about it, most foreign substances entering your body is going to come through your mouth and digestive system. So it makes sense that most of your immune system is there. And when you take these, they can really change your bowel movements. They can really make things, I think they help a little bit take the edge off the hives, but you know, it's just something that it's gonna be different for every person, and the type of probiotic you take, it's going to be different for everyone. Some people may find better success with this brand. Some people may find better success with that brand. Again, I'd recommend talking to your doctor before taking any probiotics. Antihistamines and mast cell stabilizers are something also that's important to keep in mind. And I want to talk a little bit more about that, because that's usually the first line of treatment. If you go to a doctor or you go to a dermatologist or whatever, they're probably going to prescribe you an antihistamine. And people have mixed results with them, and I've had mixed results with them. In most cases, they haven't helped me tremendously, but they have sometimes taken the edge off. I'm going to read to you a quick list of some antihistamine types so you can get familiar with it. These are the H1 antihistamines, which mean that they just simply act on the H1 receptors. Hydroxyzine, loratadine, which is the brand name Atarax, loratadine, which is Claritin, cetirizine, which is Zyrtec, desloratadine, which is Clarinex, ketotifen, which is Aloe. We got Zizol, I think is how you pronounce that, Qdol, Benadryl, Periactin, Pepcid, and Zantac. Those are actually H2 antihistamines. And there's a lot of different antihistamine types out there. Those are probably the ones you'll be prescribed. And hydroxyzine, doxepin is also another one, which is kind of acts as an antidepressant. I'll talk about that probably later, but any of those antihistamines could help you. Now, the thing to keep in mind when you take an antihistamine is, you know, don't take one antihistamine if your doctor prescribes you and it doesn't work and just say, I'm giving up with it. Because some people have tried some antihistamines and they didn't work at all, and then they've tried another brand and they got quite a bit of relief from that. So if you're looking for a way to take the edge off, they could help you. They tend to help most in cases where you have a mild case. If you have a severe case of cholinergic urticaria, they're probably not going to help that much, but they can also help if you're going to try to do some exercise therapy or sweat therapy to kind of take the edge off there too. And one thing that I noticed when I'd read an article about sometimes you can combine H1 and H2 antihistamine types, and you have to be very careful, and I don't think that's safe to do long term, but I did try that. I took an Allegra, which is fexofenadine, and a couple hours later, because I think I read somewhere that you need to take them separately apart, I think I waited a couple hours, and I took a Pepcid or a Zantac, I can't remember which one, I think it was a Pepcid. So that's an H1 antihistamine and an H2, and the H2 antihistamines work on the receptors mostly in your stomach, and there are other receptors in your body, and the H1s work on the other receptors. And so when you take those together, sometimes you can have a little bit more of a better result than just taking one type. But again, that's dangerous. You want to talk to your doctor, and it's not something I ever did long term. I think I maybe took that combination maybe 5 times in my life when I really needed to try to get my symptoms down. Like one time, my patio door, when we first moved to my house, the patio door was leaking. I had to get a new one, and it was really hot. It's like 70 or 80 degrees outside. And I was thinking to myself, I cannot do this with cholinergic urticaria. And so I took both of those, and I was still breaking out in hives a little bit, but it took enough of the edge off to where I could get through the day, and I got the door installed. Now, one of the things you got to be aware of, there's a lot of side effects with antihistamines. You can have everything from, you know, dry mouth. It can make you drowsy. You can have stomach cramps, like Zyrtec would cause stomach cramps. And by the way, the one that worked best for me by itself was Allegra, which is fexofenadine, but some people see better results with Zyrtec. Some people see good results with Claritin, believe it or not. Another thing you want to keep in mind is the H2 antihistamines, which are the Pepcid and Zantac. If you take those over a long period of time, a couple of studies or medical reports that I've read or something like that said that men can actually grow breast. So gynecomastia is just where men grow breast. That has been associated with long-term usage of that type. And antihistamines in general over a long period of time could give an increased risk of brain cancer. So those are just some side effects that you want to be aware of when you take them. But generally speaking, most antihistamines are relatively safe. If you're pregnant or taking other medications, you definitely want to talk to your doctor about it to make sure it's safe for you. As far as anabolic steroids, there has actually been some medical literature where individuals have been treated with danazol, which is a type of anabolic steroid that's the type that makes you build the big muscles. And most of the research studies, some suggest that it helps reduce the symptoms, but most of those research studies, they come back and they say, you know what, but the person's symptoms eventually return and so forth. Steroids, there's a lot of side effects with steroids. My wife is a registered nurse and she specializes in cardiology, and I can tell you right now, steroids will mess up your heart valves, and as will IV drugs, by the way. Don't take IV drugs, because my wife has had patients even younger than me having to have heart valves replaced because of IV drugs. But anyway, sorry to get off topic. Corticosteroid, but the key point with the anabolic steroids is I don't think that's something that most people should pursue, but it's been mentioned in some medical literature. You could research it on the internet if you want more information. But corticosteroids are a different class of steroids. These don't build muscle tissue. These reduce your immune system. And I've had a couple corticosteroid shots. The first time was, as I said in my Hives story video, when I went to the dermatologist for the second time and he gave me a corticosteroid shot in my backside. And I don't know what kind it was. There are different kinds like Kenalog and prednisone and a couple other brand names like that. I don't know what kind they gave me, but it didn't, I don't think it worked. If it did work at all, it may have worked later on, because sometimes when you have a shot in your backside like that, the chemicals will release very slowly in your body throughout a period of time, and Kenalog especially is designed to do that. And that may have been what kind of shot my hives down for a while, but I eventually went back when my hives became severe a few years later, and I talked them into giving me another corticosteroid shot, hoping that I could get some relief, but that second time it did nothing. And corticosteroids over a long period of time can cause numerous side effects. It can thin your skin almost to like paper thin. It can put you at high risk for diabetes, high risk for infection, maybe even cancer. And so it's not really a viable treatment for cholinergic urticaria for the long term, and I really would recommend against it if you could find something safer. Beta blockers have been mentioned in treating this, and beta blockers just kind of slow down your heart rate and so forth. And most of the medical literature I read on that, it seems like maybe it helped a little bit. To me, it doesn't seem worth it, but you know, you can look up beta blockers, talk to your doctor about it if it's something you want to explore. That and corticosteroids and anabolic steroids, those are things I would really not recommend you pursuing, but in the sake of just trying to mention everything that's been documented, I'm trying to cover everything here. So some people have used UVB therapy. And this is an interesting therapy, because what they'll do here is you have to use a specialized machine, usually in a dermatologist's office. And it's kind of like sitting in a tanning bed. They shoot specialized ultraviolet light at your skin. And some people have reported with various physical type of hives, especially cholinergic urticaria, that having this type of therapy actually over time made their hive symptoms go away, but they have to keep it up. And the obvious risk with that is that, you know, you're going to have skin damage from all this, you know, UVB light, and you're also going to have a risk for skin cancer and so forth. So that's something that, you know, you can just keep in mind. Benzoyl scopalamine, and that is something else that has been used, I think, topically. It's an antispasmodic medication. I've seen that in medical literature, but again, that kind of goes with everything else. It doesn't seem like it really does much for it. People seem to still have the symptoms, or the symptoms returned. So that's not, I don't think, a mainline treatment for cholinergic urticaria, but again, it shows up, so I'm just mentioning it. Anti-immunoglobulin E therapy with, I think it's pronounced omalizumab. I don't know how that's pronounced, but anyway. This therapy is something relatively new that shoots down your immune system and targets the IgE, immunoglobulin E in your body. And what that does is it's supposed to help reduce inflammation, and they're using it for some allergic disorders. I know that some articles have hinted that it could cause cancer because of its suppressing effect, and I know that some other side effects are wheezing, shortness of breath, hives, dizziness, abdominal pain. So since IgE is an important part of your body's defense mechanism in detecting cancer, you know, that's why some people suggest it could. So, you know, I know that one person had severe hives. I think his name was Will Dev, was a member on the website. I think he reported wanting to try this. I think he actually did, and it didn't see relief, if I remember correctly. I think a couple of other people reported that this didn't really help their hives. That it has been associated with helping some allergic type of disorders, but again, it's something that, you know, it could have a lot of side effects and risks. So you definitely want to, you know, think hard before you try something like that. Some people have mentioned neuropathic medicine or nerve medicine, such as gabapentin, and this is a type of medication that treats anxiety or epilepsy and so forth, and some people have reported on the website that it helped them. And this is not really something that's used to treat cholinergic urticaria. It just a person kind of thought that it helped them a little bit. It's not something that I personally would probably try after looking at some of the side effects and so forth, but again, it's something else to consider. And antidepressants, a few people have reported that antidepressants or anti-anxiety medications have helped them. And one of the ones that come up a lot is doxepin. And those are antihistamines that also have the anti-anxiety or antidepressant functionality to them. So it's kind of like an antihistamine, antidepressant kind of in one, if you kind of think of it that way. And there have been, I would say, maybe 3, 4, 5, 6 people that I can remember off the top of my head on the forum that have came back and reported that this seemed to help them. I've never tried it personally, and I'm always a little reluctant to mess around with any medication that does anything to your brain in the sense of like changing your depression or anything like that. But some of these people seem to report that this does help them quite a bit. It's something you can look into and talk to your doctor about it. I think it is a prescription-based medication, so you would only be able to get that through your doctor. Hormone and thyroid medication. Again, I talked in the previous video how some people, a couple people have reported having a thyroid issue, and when they got the proper medication to bring their thyroid levels back up, it seemed to help their hives. That's only going to help if you have a thyroid issue. It's probably not going to help the majority of people with cholinergic urticaria, but if you have a family history of that, you might want to talk to your doctor about having your thyroid checked. Something called montelukast, which is the brand name Singulair. It's a leukotriene receptor antagonist, and they use that sometimes to treat chronic hives or asthma. And there is someone on the forum that has reported that that has helped them in conjunction with, I think they use antihistamines with it. And they got quite a bit of relief from that. They would still get a little itchy or a little swollen sometimes, I think, but for the most part, it kept most of the symptoms at bay. Now, that medication also has some side effects, and it's possibly associated with a syndrome called Churg-Strauss syndrome, and you definitely want to talk to your doctor about side effects before you would ever try that as well. And that covers up the major medicinal ways to treat cholinergic urticaria using standard medicine that's out there. My biggest thing is I always advocate to try to do everything as naturally as you possibly can, and to avoid these medications which have, you know, bad side effects, especially if they're not giving you 100% relief, and most of them won't give you 100% relief. Having said that, you know, you may, if you're desperate, if you have to do something, it's something you can work with your doctor about. You know, I have some of this on my website as well, and all this is listed in my book. So if you want to kind of go through each one, you could talk to your doctor about it and see, maybe try one thing, try different antihistamines, start with the safest, which is antihistamines, try different ones, and just see how your body reacts to them, and then move on to other medications. In the next video, I'm going to talk about some other things that have been mentioned on the site. I guess you could say they're kind of homeopathic, or just maybe treatments that I don't really feel probably will help your hives, but I want to mention them just for the sake of putting it out there and just making you aware of them. So you want to stay tuned for that in the next video. And I'm also going to talk some more about, you know, sweat therapy and how people go about that, and exercising with this disorder, and how I cured mine with diet and the other things that I do. So definitely stay track of this video. Thank you so much for watching, and God bless.